Hello and welcome to Nursing Bites by Nadia. I'm continuing the video series dedicated to fundamentals of nursing. Today I'm going to speak about one of my favorite subjects, concept of cultural diversity and respect. Being a representative of a multicultural family and a first-generation immigrant, I love to educate about culture, so let's dive into it. Cultural diversity can be defined as the coexistence of different ethnic, biological, sex, racial, socioeconomic groups within one social unit. These groups include, but are not limited to, people of varying religion, language, physical size, sexual orientation, age, disability, occupational status, and geographic location. Nurses and other healthcare providers must be familiar with the concepts of cultural diversity in order to understand characteristics common to certain populations. Nurses must also be sensitive to cultural factors in order to provide culturally respectful care to people from diverse backgrounds. The concept of cultural respect enables nurses to deliver services that are respectful and responsive to the health beliefs, practices, and cultural and linguistic needs of diverse patients. Moreover, cultural respect is critical to reducing health disparities and improving access to high-quality health care. It is also vital to remember that each person may be a member of multiple cultural, ethnic, and racial groups at one time. Therefore, different cultural values may guide a person in different situations based on what is most important to that person at the time. In addition, any person should be viewed foremost as an individual, not as a representative of a cultural group. Culture may be defined as a shared system of beliefs, values, and behavioral expectations that provide social structure for daily living. The NIH defines culture as a combination of body of knowledge, a body of belief, and a body of behavior. Elements include personal identification, language, thoughts, communications, actions, customs, beliefs, values, and institutions that are specific to ethnic, racial, religious, geographic, or social groups. For nurses who practice person-centered care, these elements influence beliefs and belief systems surrounding health, healing, wellness, illness, disease, and delivery of healthcare services. Ethnicity is a sense of identification with a collective cultural group, largely based on the group members' common heritage. People within an ethnic group generally share unique cultural and social beliefs and behavioral patterns, including language and dialect, religious practices, literature, folklore, music, political interests, food preferences, and employment patterns. Although the term ethnicity is often used interchangeably with race, these terms are not the same. Racial categories are typically based on specific physical characteristics such as skin pigmentation, body stature, facial features, and hair texture. Federal standards for race classification provide 5 categories, including American Indian or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, and white, and provide the opportunity for people to identify themselves in multiple categories. We're not inherently born to be culturally sensitive. It is a skill that has to be built. In order to provide the best cultural sensitive care possible to the patient, let's go over factors that inhibit such sensitivity. Stereotyping, for example, is assuming that all members of a culture, ethnic group, or race act alike. Negative stereotyping include racism, ageism, and sexism. These are mistaken beliefs that certain races, an age group, or one biological sex is inherently superior to others, leading to discrimination against those considered inferior. To weed out your own cultural biases, catch yourself every time you look at a picture or at a person who is of a different ethnic or cultural background than you. What do you assume of that person? If you find yourself having negative assumptions of that person, think, are those based on your stereotypes? That would help you keep your stereotypes in check. Also affecting cultural sensitivity are cultural imposition, which is the belief that everyone else should conform to your own belief system, and cultural blindness, which occurs when one ignores differences and proceeds as though they do not exist. Cultural imposition and cultural blindness can be observed within the healthcare system, especially in regards to non-traditional methods of care. Cultural conflict occurs when people become aware of cultural differences, feel threatened, and respond by ridiculing the beliefs and traditions of others to make themselves feel more secure about their own values. So now the question becomes, how to become culturally competent and provide culturally sensitive care? First of all, it is important to establish communication and rapport with the patient. If you overhear the patient speaking a language different from English, do not automatically assume they don't speak English. The US is a multicultural country. Many residents are bilingual. Ask which language is preferred by the patient for communication. If a patient does not speak English at all and you don't speak patient's native language, find out how to acquire translation services. It would be wise to also ask the translator on the line to give you several commonly used words such as pain, to eat, medication, bathroom. Patients will appreciate your effort to learn and to make their experience more comfortable. Also, admit to the lack of knowledge and ask questions. If you've never heard of a country where the patient's from, be eager to learn. Ask questions. Keep an open mind. Judgment is one of the tools that humans have developed through evolution, and it is an important tool to survive. We have to be able to make judgments about different situations, life decisions, etc. But when it comes to other people's culture, the best route is not to judge. You can explain and educate the patient about what the local regulations are, whether it be a hospital setting or outpatient rehabilitation setting. Try to accommodate for those cultural practices that are not hazardous and do not go against your local regulations. Respect and communication is of utmost importance. This concludes today's video. If you would like me to speak about other topics, please do comment below. Thank you and have a good day.